Healthcare needs more than doctors and nurses. Obviously, they're important, critical, but it needs people who can organize information, support patients, prepare equipment, maintain technology, coordinate services, and keep systems working. Some jobs may offer training, apprenticeships, or shorter credential pathways. So in this video, I'll show you 8 healthcare jobs worth investigating after 40. What the training is that may involve, where your previous experience could help, and what to verify before making a move. I'm Coach Theo. Welcome back to your Encore Catalyst. Let's dive right in. Okay, let's jump right in and get this moving. 8 healthcare jobs that train you after 40. So the thing to remember as I go through these 8 positions is that these are actually realistic healthcare pathways that may use experience you already have. That's the key. And if you like this type of information or you're looking for this type of information, see my playlist, Career Bridges After 40, where I actually go through this type of information to help you with your career transition. Okay, training available does not mean guaranteed. So you want to make sure you use this distinction before spending your hard-earned money on a course or a credential. What you do want, however, is employer-supported training. Some employers may provide training, and this is great when openings clearly say training provided. Right? So they're not hiding it. They're letting you know this is going to be part of the journey. Next, you have a short credential pathway. A certificate, an exam, clinical requirement, or approved program may come first. So this is good when the cost and the timeline fit your runway. In other words, it fits your plan or your goal or your timeline. Transferable experience. This is critical. Your prior work may reduce the learning curve, not remove the requirements. But it's key to know that your prior experience as an experienced professional does not go into the trash can. That's something that you're going to be able to leverage to get you into this new position. And the important part here is that this is good when postings repeat skills and you understand that you already have those skills. So you understand there's some connection there, and you have to understand then after that what else you would need to do to be eligible to be in the running for that new slot. Now, one other thing that training requirements, certification rules, pay schedules, uh, program availability, all of these things vary by employer and location. Right? So pay close attention because you don't want to mislead yourself or have anyone else mislead you. Let's take a look at the first one. Medical records specialist or medical coder. Right? This is all about information accuracy and documentation work. Now, the best fit clue here is that it's a strong fit for records, billing, insurance, compliance, data entry, or detailed office work. If you have that in your background, you're actually in a good position to vie for a slot or a job role. The training path. Now, this may require medical terminology, coding systems, privacy rules, and sometimes certification. So you want to get clear about that so you understand what you need to do to be competitive in pursuing these types of jobs. So you want to verify before committing. Coding and records work are related but not identical. Check credentials and software requirements in the local postings. Next, you have healthcare information technologist or medical registrar. This is all about healthcare data, systems, and records integrity. What's the best fit clue? It's a strong fit for data reporting, quality, systems, records, research report, or information management. If you have this in your background, this could make you a fit. Training path, some of these roles may be entry level. Okay, so if that's okay with you, fine. Others require specialized education or certification or prior healthcare experience. So once again, you just want to make sure you're reading the posting correctly. And if you do get a screening with the recruiter, then you want to make sure that you're asking them or clarifying with them what will be needed for you to be competitive. So you want to verify before committing always. Do not assume all health information jobs provide direct training. That's key. Titles and qualifications do vary and vary widely. Next up, we have the community health worker, a people and community pathway. Right? So the best fit clue here, it's a strong fit for communication, service, outreach, education, coaching, nonprofit, or community work. These are a good fit. So you have these in your background. It makes you potentially a very good fit. Now, the training path, Bureau of Labor Statistics, BLS, notes that community health workers typically complete a brief period of on-the-job training. So this is good news. If you have some of the fits in your background, then part of your path forward will be some type of brief period of on-the-job training. But you want to, as always, verify before committing. Some states require certification. Also verify travel, documentation, emotional demands, and schedule expectations. Next, we have sterile processing technician, behind the scenes patient safety. Best fit clue, strong fit for manufacturing, quality control, logistics, inventory, regulated processes, or equipment handling. The training path. Training may appear through the employer or through employer entry roles, certificates, apprenticeships, or exam prep programs. So once again, want to verify before committing. Verify certification expectations, hands-on experience hours, shift schedules, standing, repetition, and production pressure. Let me just say something extra about this. This is the kind of work that supports patient safety by cleaning, inspecting, assembling, sterilizing, tracking, and preparing medical instruments. So you know there's going to be a high level of scrutiny. That does not mean that you don't have things in your background that fit what is necessary. So that's why you want to understand the training path and you want to verify it before committing to pursuing it. Let's just check something here before we continue. Tell me in the comments which direction fits your experience better. Information and administration, working with people, technical support, behind the scenes operations. And if you like what you're hearing so far, please give us a like. Thank you. Now, let's move forward. Medical assistant. This is blended administrative and clinical support. So these duties can include scheduling, patient intake, records, basic clinical procedures, and supporting physicians or other healthcare professionals. So you're going to be more hands-on here. So if you have in your background strong fit for scheduling, service, documentation, caregiving, hospitality, or fast-paced office work, you're in a good position to compete for some of these positions. The training path. According to the Bureau of Labor Statistics, post-secondary programs are common. Some assistants enter with a high school diploma and then learn on the job. But once again, verify before committing. That certification preferences that you either have them or you will pursue them. So you want to verify them. Patient contact, standing, multitasking, and whether the role is administrative or clinical. Next, we have pharmacy technician. Right, this is going to be good, emphasizing accuracy, customer interaction, inventory, insurance processing, prescription information, and regulated procedures. So the best fit background, right, is someone who has inventory, insurance, customer service, logistics, compliance, or high volume processing in their background. The training path, Bureau of Labor Statistics. Many learn through on-the-job training. So this is great news, right? Remember, you're an ex-professional or a current professional, and you understand how to learn on the job. So, and many states may require or regulate pharmacy technicians, so they may require certain types of training and such and backgrounds. So you just want to verify before committing what the state requirements are, certification exams, background checks, shift work, customer pressure, and error risk, right? You want to understand your tolerance for all of this. Surgical technologist, all right? Now, this is great. Specialized operating room support. It's a strong fit for people comfortable with exact procedures, sterile environments, pressure, and team coordination. Bureau of Labor Statistics. Surgical technologists typically need a certificate or associate's degree. Certification may be required or preferred. Okay. So this is going to be key because here you're maintaining a sterile environment, preparing instruments, supporting the surgical team, and following exact procedures. In other words, more hands-on. And so this is a position that is akin to specialized operating room support or the pathway towards it. This is not an easy entry-level healthcare job. So once again, verify before committing. Verify the accredited training, the clinical requirements, certification, and of course, state rules. Medical equipment repairer. Now, this is a technical bridge into healthcare. So the best fit clue. Strong fit for those with electronics, field service, military technical work, maintenance, IT, telecom or equipment repair. The training path. Bureau of Labor Statistics says education varies. Many workers need an associate's degree or technical preparation for complex equipment. Yeah. So this position, this is the strongest technical bridge in this presentation. I want you to understand that there is the potential for a lot of troubleshooting, preventative maintenance, calibration, documentation, electrical or mechanical knowledge, safety, and working with users of specialized equipment. So that's why that best fit, or the list of best fit clues that I have here on the screen will be critical. But as always, you want to verify everything before committing. So you want to verify the required technical background, manufacturer training, travel safety procedures, and documentation expectations. So let's take a look at a composite career example. All right, this is not one specific person and is not a guaranteed income or outcome, but it is a composite. So you want to imagine an experienced office administrator who has spent years managing records, schedules, customer questions, confidential information, and detailed processes. Now, this person may not have worked in healthcare, but the foundation could connect naturally to medical records, health information, patient coordination, or administrative support. Right? You're going to be working with confidential records, scheduling a service, documentation accuracy, process follow through, right? And you will need to become familiar with the appropriate healthcare terminology. And then, of course, privacy still needs to be learned. So this is going to be, once again, it's going to be critical. Mhm. So your experience is not irrelevant. It simply has to be translated into the new environment. Another composite career example, technical and operations pathway. Now, this is illustrative, not guaranteed. Technician or operations pro going into the healthcare technical lane. Right? So consider a technician, manufacturing worker, field service professional, logistics coordinator, or regulated operations employee. That background may create a stronger bridge toward medical equipment repair, sterile processing, surgical support, or another technical healthcare role. Right? So the better question is not only have I worked in healthcare, is which problems have I already learned to solve that healthcare employers still need solved? So this is a assignment, and this is a practical assignment, right? This is what I call the 10 posting test. Do this before you pay for training. Once again, so save your hard-earned money until you absolutely need to spend it to move forward. First, choose no more than two paths, right? No more than two pathways that match existing strengths and working preferences. Two, review at least 10 current job postings in your location and record the requirements that appear repeatedly. All right, so write down repeated titles, skills, credentials, schedules, and pay ranges. Third, confirm the training sequence. Contact employers, workforce programs, community colleges, or approved training providers, to confirm where the training occurs before hiring, after hiring, or through a separate credential program. So once again, do not just run around purchasing training based only on a school advertisement. So, where to start before you pay? Use low-cost research first, then verify the hiring path locally. First up, Career One Stop and American Job Centers, right? So, or your American Job Centers are local, and you'll be able to get, just Google and find out which one is closest to you. And so you can look for local training programs and ask whether WIOA and other funding support may apply, right? Uh, Once again, you want to take a look at that before paying out of pocket. So these are best for local certificates, workforce grants, job search help. So in other words, you want to contact these two entities and get smart about what's out there. A lot of people don't pay close attention to these programs. They either don't take the time to investigate or they assume it's not for them or whatever. I'm telling you, take the time because you could easily be setting yourself up for a new career. Apprenticeship.gov, all right, for healthcare. This is going to be great. You want to search registered healthcare apprenticeships and learn which programs combine paid work with classroom instruction. This is best for paid training pathways and employer-sponsored routes. edX free audit and intro courses. I love the word free courses. All right. So use free audit courses to sample medical terminology, health data, public health, or basic healthcare topics. This is the best fit for exploring before buying a certificate. Certificates aren't free, obviously. So you want to make sure that you're doing your homework well ahead of time. So here's the rule. Introductory learning is for exploration. It does not replace a required license, certification, clinical requirement, or employer-approved program. Do your due diligence. So remember, healthcare can be a bridge, not a guarantee. Accessible does not mean effortless. Okay. The opportunity is that healthcare needs many kinds of workers and the need is growing. So your experience may connect to more of those jobs than you realize. The opportunity is not that healthcare will automatically hire anyone who applies. That's not true. The opportunity is that healthcare has the needs for a variety of types of workers, and your previous experience may be the key. So watch next. Get paid while you train after 40. That's a great video that continues or helps you continue this journey of exploration of making a transition into a new job or a new career. All right. So once again, like, share, subscribe, comment. It helps us help you. And I will see you next time as we continue our Encore adventure together. Take care, everyone.